Ladies and gentlemen, let me begin by welcoming all of you here today and tell you how exciting I think it is that someone of John Mendelsohn's stature and accomplishments has agreed to become a senior fellow here at the Baker Institute upon his retirement as president of MD Anderson. I'm equally as excited, of course, that L.E. and Jenny Simmons have endowed this position. An extraordinarily generous gesture on their part that makes it possible for John and the Institute to come together in this way.
As a Baker Institute Senior Fellow, Dr. Mendelsohn will begin his work here in March of 2012. He will collaborate with scholars across Rice University and the Texas Medical Center. He will identify and evaluate discoveries of new technologies, therapeutics, and best practices, as well as promote policy recommendations to improve health outcomes both locally and globally.
Healthcare is the issue for the next 10 or 20 or 30 years until we get it right. And I think Rice, and I think particularly the Baker Institute, are extremely well positioned to really lead the discussion on a practical way, and on a way that is going to get this country addressing the issue in the right way, and in a way that will really help our economy and help the people of the country.
This also sits at the intersection of Rice and the Texas Medical Center. That has been a central part of our strategy as a university. The Baker Institute has been a key element of that strategy, and this will strengthen its role as part of our engagement with the Texas Medical Center.
It is very exciting for me to think that I'll be back at a university that is a complete institution of learning, examining public policy and economics and history, and even in literature. I have some secret plans in that direction. So, and Rice is a very special part of our lives, and this is tremendously enriching that for us.